Hi everybody, my name is Gina Lisa Monteroso and I am the CEO of Medicare and Medicaid Advisory Group, and we are here today to talk about Medicare Open Enrollment. As you know, Medicare Open Enrollment already started the 15th of this month and it will be going through December 5th of this year. So we are here to answer any questions and any concerns that you may have about Medicare Open Enrollment. Even if you're happy with the coverage that you have now, it's always good to kind of compare and see what's open with new coverages that will be available for 2019. So what do we do here at Medicare and Medicaid Advisory Group? We assist the elderly and the disabled in applying for Medicaid so that they are able to get coverage for home care, Medicare, for home care, assisted living, and nursing home. And I am here with my team as well, so they'll be helping me along this live segment so we can kind of make sure that we're able to answer everyone's questions. So let's see what we have going on right now. Majority of our clients seek 24-hour home care. The 24-hour home care just assures that our client is able to stay home, get all the care that they need at home, so then they don't have to go to a nursing home or an assisted living. Let's see what else we have going on. So how did Medicare and Medicaid Advisory Group start? At the age of 26, I gave birth to an amazing person by the name of Tara. Tara was born with Down syndrome, and I had no way to navigate the system to show me what services were available to them. When she was born, the doctors told me the best option would be to give her up for adoption, which was pretty, it was pretty sad because I was happy about the birth of my daughter, and you know, the medical team was just giving me a dark cloud that we weren't going to have a happy life, and things were going to be pretty bleak with her care, and there were no other options. So I just moved on with my daughter, and I was able to myself navigate the system and get the care that she required. And what I kind of realized was that I am not the only one struggling with trying to care for someone who has a disability. And what I realized is that everyone's dealing with someone who's sick, who's elderly and disabled, and they need some assistance. So Medicare and Medicaid Advisory Group was born, and you know, we're here to just make sure that we're just gonna guide and assist and make sure that everyone has all the assistance information they need so that they're able to navigate the system. So we have a couple of questions. First question, will I be enrolled automatically in Medicare when I am 65? Yes, when you turn 65, prior to a couple of months before your birthday, you should be receiving a packet from Social Security alerting you that you are eligible to join Medicare and you need to fill out some forms. The best option that I tell everyone when they're about to enroll into Medicare is to go to ssa.gov and open up your own account. You can create your own account, and from this online portal you're able to get all the information that you need about what benefits you're eligible for, even an estimate of what your Social Security check would be or disability check would be, and even information about your Medicare enrollment. So always make sure that if you're moving into the process of enrolling into Medicare, to go to ssa.gov to open up your own account online. I am a caregiver and I feel burnt out. I really need help. My siblings aren't helping and I just need a break. What are my options? Caregiving is a big job. It's what I always tell my clients is it's not a job that you can handle by yourself, and you do need a team behind you. What I suggest is just to make sure, find out the insurance that the person that you're caring for has. If the client has, if your loved one has Medicare, what people don't know is that Medicare actually does have a home care component, and Medicare will pay up to 4 hours of home care along with some additional rehab as well, which would be physical therapy, speech therapy, and occupational therapy. So, number one, find out what insurance they have. If it's Medicare, you can get some home care assistance free of charge. All you would have to do is just make sure that this person that you're caring for goes to the doctor, gets a referral, and you can get this client up and running to get some home care that would give you some relief for at least 4 hours a day. If the loved one has private insurance, what people don't normally know is that private insurance also has home care coverage as well. So call the insurance company and find out if there's any home care coverage. And again, you would definitely need a referral from the doctor, and you can get that up and going as well. Can I go to any doctor with Medicare? I have traditional Medicare. Yes, I love traditional Medicare. So what we are here to kind of explain to everyone is the difference of Medicare. There are two types of Medicare. There is Medicare traditional, and that's where you have this red, white, and blue card. And that's the card where you can go to any doctor, any hospital, without a referral, as long as the provider accepts Medicare. Then we have Medicare Advantage. Medicare Advantage is a type of Medicare where it's actually attached to a private health insurance company. We have Health First is a Medicare Advantage program. Blue Cross and Blue Shield has a Medicare Advantage program. With a Medicare Advantage program, the coverage comes with a drug component as well. So if you sign up with a company, just remember that you will be signing up with a company that you would have to use their in-network providers. So make sure that your doctor is in network, your pharmacy is in network as well, and always remember that any special medical service that you need, you would require an authorization from these Medicare Advantage programs, whereas if you enroll in traditional Medicare, you do not need an authorization. So I always tell my clients, especially the elderly and disabled, you don't want to be stuck with a gatekeeper and requesting whether you can get care or not. You want to go and have traditional Medicare, and I tell everyone kind of remember it as the Medicare Freedom Plan. You can go to any doctor, any hospital. You can even take it out of state. That's the best option for everyone. My professional opinion. Let's see. How do I know it's time for my parent to move into a nursing home? That's a good question. How you make that decision is, I always say, use that as plan double Z, meaning that you went and you exhausted every option that you possibly can, and the nursing home is the only option. Ask questions. Find out what insurance your loved one has. See if there's coverage to cover home care. Inquire about Medicaid. Medicaid in New York City does pay for 24-hour home care. Find out if your loved one can qualify for Medicaid, and always remember that you're able to plan for Medicaid. You can always call our office and find out what services that we're able to provide, but make sure that you want to keep your loved one at home, because what you have to take into consideration when you're making that decision is, what would you want if you were in that position? And we all want to stay home. We all want to make sure that, we're around, we have surroundings that we're familiar with. To be admitted into a nursing home and to be put in a community area with people that you don't know when you're sick, it's not the most happy environment. So you just want to make sure that you explored all your options. And always remember, a nursing home is just like a home. Whatever services a nursing home can provide, nowadays all the services can be provided at home as well. So just make sure that you're able to just look into all the options that they have out there. What do we have here? My new Medicare card hasn't arrived yet. What can I do? Contact the Medicare office and tell them that you haven't received your card. If you have your old card, you can even bring your old card to the provider and let them know that your new card hasn't arrived. But you do have to contact Medicare and advise them that your new card has yet to arrive. You can call Medicare at 1-800-MEDICARE, MEDICAR, to check about the status of your Medicare card. What are top tips for retirement? Top tips for retirement is to find out if you're able to retire with the health insurance that you have at work. Some companies allow you to keep your insurance at work, and what people don't know is that if you are able to keep your work insurance, you can also apply for Medicare as well. And then you would have 2 health insurance. And people tell me, why would I want 2 health insurance? Well, if one benefit exhausts from one insurance, you are able to go on to the second insurance and utilize the benefit from the second insurance. So the more health insurance you have, the better. What else we have going, guys? Medicare, traditional. Okay, so let's talk about Medicare. So we have the Medicare Open Enrollment. What are we looking for Medicare Open Enrollment? We are looking to see if the Medicaid we currently have is working for us. And how do we know if it's working for us? Is my doctor having a problem getting paid by Medicare? Are all my services that I need are getting paid through Medicare? Do I have high drug copays? Is there a medication that this Medicare component doesn't cover? Those are the little things that you want to look for to kind of decide, should I be disenrolling and going on to a new Medicare plan? Again, traditional Medicare. If you have Medicare and your card has a name of a company on it, and on the bottom of the right hand of the card it says RX, you are actually enrolled in a Medicare Advantage plan. That is called in the healthcare world Medicare Part C. And again, is that plan working for you? Do you have difficulty getting these services that you want because you have to wait for an authorization? If that's something that's happening to you, if you're able to disenroll now and go into a traditional Medicare, and you don't have to have a authorization. You can go to any doctor, any hospital, any provider that accepts Medicare. Drugs. Make sure that you don't have high copays. You want to, having health insurance, you want to make sure that you're paying less out of pocket and your insurance is covering more of the benefit. So you can actually go onto www.medicare.gov and input all of your drugs, and you can compare benefits and see what Medicare drug plan is good for you. Peggy asks, are Advantage plans good? Again, it's up to you. My professional opinion, I feel as if the Advantage plans do not let you use the benefits that you are eligible for. I feel like they cap the type of service, whether it's a special drug or Medicare covers, and I'll give you an example. Medicare covers you to go into a rehab. The benefit comes 100 days. So let's just say your elderly loved one or someone falls and breaks a hip. They go to the hospital, and now they have to go to rehab in a rehab center. Medicare comes with 100 days. Medicare will cover that stay for 100 days. What happens with Advantage plans is that every week the nursing home has to request permission from this Advantage plan to continue with the rehab. So depending on what type of notes are submitted to your insurance plan, the insurance plan may probably say, hey, you know what, Peggy, you've had enough coverage. We're not going to let you go through the 100 days. We're only going to cover 2 weeks. Whereas if you have traditional Medicare, the facility will look at the overall care, see how well you're doing, and they don't have to submit nursing notes, and they don't have to request permission from a health insurance. They'll say, you know what, as a team, Peggy, yes, we will continue the care, and we will continue to give you the rehab. But again, Medicare Advantage plans, they're a little tricky. And recently, the New York Times put in an article. What date was that article? October 5th.
It was actually last Saturday.
Last Saturday, the New York Times put in an amazing article, and it talks about how Medicare Advantage plans purposely deny coverage so that they're able to save money. So please just be very careful. I prefer traditional Medicare. Minerva asks, is someone younger than 65 but totally disabled to qualify for Medicare, even if he has Medicaid? Yes. So someone who becomes disabled under the age of 65 and they have worked and now they become disabled, they do qualify for Medicare. You go to Medicare, you tell them the situation, and they will look and see if you worked enough to get your Medicare now. And you are able to have Medicare and Medicaid. A lot of people think that you're not allowed to have both. You can have both, and you want both. So the answer to that, Minerva, is yes. Someone younger than 65, totally disabled, as long as they worked and put in the required quarters to become eligible for Medicare, they are able to get Medicare. What else we have? Yes, Minerva, even if he has Medicaid. What else? Total Medicare. Which one we have?
Common questions, A versus B.
Oh, another common question we have is Medicare Part A and Medicare Part B. So we, when we work, there's taxes that are deducted from our salaries, and we buy into this Medicare program. So when we retire or if we become disabled, we actually get health insurance, and it's Medicare Part A, and Medicare Part A covers hospital coverage. Then Medicare is going to say, well, you have an option to buy into Part B. Medicare Part B covers your doctors, your equipment, any services in the community. And you want to buy into Medicare Part B. You just don't want to have coverage for hospital only. You want to have coverage to go to the doctor. You want to have coverage to get rehab outside of the home. You want to be able to get any equipment that you need. but you have to buy into the Medicare Part B. Right now, the Medicare Part B is $134, and for 2019, it will be going up to $135.50. I always tell everyone, you know, investing in your healthcare is an investment that you want to do and you want to have. You never want to wait till the last minute when something happens to you and you need that coverage in, and you have to start just looking and putting the coverage in place. Buying into any healthcare program right now will always work for someone and at the end, because what we don't know and what we don't prepare for is the time that we become sick. What else do we have here?
More questions that we received before.
Where?
The questions that we received before.
What's the difference between assisted living and a nursing home? A nursing home is where we have registered nurses and LPNs on staff to assist with the elderly and care for them. It's a confined sort of type of facility where you do require lots of monitoring, and you may need you may be bedbound and you need full round-the-clock assistance with a nurse. An assisted living is kind of you're independent, but you really just need some care, but not full total care. The assisted living gives you the benefit of your own comfort of having your own apartment, whereas sometimes in nursing homes you have to share a room. That's pretty much. I could get a little more detail, but it gets a little gray as far as who, what, where, and how. But nursing home, we kind of always say you want to make sure that whoever's being admitted into nursing home is bedbound, and they do require that assistance, and they're unaware of their surroundings. Assisted living is for mom and dad can't really function at home, and they fall a lot, but they're pretty independent, and they physically and mentally they're okay. That would be a suggestion for maybe an assisted living. What other questions we have? We are in a lot of debt after a family member needed extensive medical treatment, but we're not given information on Medicaid at the hospital. How can we recover financially? So if someone has a hospital stay and all of these bills start to accumulate, and your insurance, between deductibles and copays, you're not able to pay them. Every hospital in New York has charity care, and with the charity care, depending on your monthly income, there is a sliding scale fee where they can adjust the bill to accommodate into making monthly payments suitable toward your income. So always make sure whatever services that you get in the hospital, that you are able to kind of ask for any financial assistance. Don't be ashamed to ask for it. Healthcare is very expensive, and these programs are put in place just to make sure that we are able to afford the care that we need. What else do we have here? If you just joined us, my name is Gina Lisa Monteroso, and I am speaking about Medicare and Medicare this afternoon. So please feel free to send me some questions or comments below in reference to any Medicare and Medicaid questions. And please share this video as we want to reach as many caregivers, seniors, and people with disabilities as possible to ensure they can access information they can trust during open enrollment and understand their entitlements. To see if you're eligible for Medicaid, we have a quiz on our website at www.mmag.org, so be sure to check it out. To learn more about your options, you can also fill out the contact form on our website, mmag.org, or call us at 646-745-9122. What do we have here?
Part 2.
Yeah. Do we have people right now online? We do. Any questions for anyone who's online? Part D, if you do not enroll in Part D when you first become eligible, you will have to pay a late enrollment penalty. So make sure that if you are eligible for Part D that you enroll, and you don't waive your entitlement to enroll into a drug plan. Make sure that you enroll as soon as possible so that you do not get a penalty for a late enrollment. The penalty can be waived under certain circumstances, but as soon as you're eligible for Part D, make sure you definitely enroll as soon as possible. If you enroll onto a traditional Medicare, make sure that you also enroll on a Medicare Part D. If you enroll in a Medicare Advantage plan, that Advantage plan will also cover your drug plan. Hi Addie, hope our advice is helping. Don't hesitate to let us know if you have any questions. What else we have going on here? No, this is too much here. There is, I spoke earlier in reference to the Part B, where there is a deduction from your Social Security check to cover the Part B coverage. There's a program called the Medicare Savings Program, where the Part B can be waived if you fall within a certain income. The program is really good. You definitely have to fall with, there is an income range in order to qualify. So if you kind of feel that you are